Yes. Karibu manzetu, tumetoka Daro kujifunza mambo mbili tatu. We are back on the launch. Tuko back on Entertainment Friday, and of course hapa hivi tunaongelea everything about entertainment. Na tukianza show yetu ya leo tulikuwa tunasema ni aje leo tunataka kucelebrate wase wenyewe wana make an impact, watu wenyewe wako on the forefront kuhakikisha manzee wanasaidia in the fight against COVID-19 ama coronavirus, kwa watu wenyewe wajajua hizo mambo za COVID na nini. Na tumetaka kujua the role of the youth in the fight against COVID-19, and today tuko na two members of the Kenya Student and Novice Nurses. Nataka tu mjintroduce tu nyi wenyewe manze. Ladies first.
Okay, my name is Joyce Agina. I'm a student leader at the University of Nairobi. Yes, that's a summary about myself.
Haya, tufike basi kwa kiongozi hapa mwenye suti.
Hello. My name is Rashid Salim. I'm currently the chairperson for Kenya Student and Novice Nurses chapter, a chapter under the National Nurses Association of Kenya. It's the reason we're here to share more on what we're doing in responding to COVID-19 as youths and young nurses.
Yeah, so from your brief, man, I read that you guys are having plans and projects on how you can help combat COVID-19. And I think now is the right time for you guys to just give us a brief about the same. Yeah. Yes, Joyce.
That one I leave to Rashid.
To Rashid,
Yes.
okay. Rashid.
So as we've heard about COVID-19, I'm sure everyone now knows there is COVID-19 with us.
Yeah.
And everyone is focusing on media and social media. So we thought as young nurses, there's a platform, there's a team of people, there's the marginalized group that are not really, do not have access to media, to, published media, that also deserve to be reached to, because these are the people who are equally at risk or at a high chance of spreading the virus into the communities. So we thought of coming up with an agenda to reach out to this marginalized group of people. We're talking of children's homes. You're talking of people in the remote areas back in our villages that do not have access to TV. And even if they had access, they have different competing priorities. These are people who are waking up to go to the shamba, the people who are waking up to, look for something to put on the table. They don't even have time to, reach out or watch the news that we're doing. There are people who need us to be there physically to teach them, to educate them. Two, we also looked at it in terms of many of us are giving briefs of prevention and such like things, but we're not giving them the items or the equipment that they need. When you tell people wash your hands, sanitize, are you providing the soap? Are you providing the water? So we as young nurses, and with the support of the National Nurses Association of Kenya, came up with the idea where we go to the rural setup, meet the people at their congregation points. For example, we went to Kamwangi. They have the tea buying centers. We go to the tea buying centers when they are coming, because definitely they'll come. That's where they get their bread from. So we meet them there, educate them on the essence of hand hygiene, preventing coronavirus, because for them they think coronavirus is for the people in Nairobi. It's for the white man. It's not for them. So you first of all have to give them the sense that coronavirus is for all of us. Then once we've taught them on hand hygiene, we've taught them on preventive measures, we also give them liquid soap. Depending on the availability and our capacity, we give them, I remember we've given about 50 liters up to now of liquid hand wash and hand sanitizers. So we give them, at least when we teach them, you need to wash hands, we also give you the soap so that you wash hands.
Okay.
Yeah.
So how long has the association existed? Kenya Student and Novice Nurses.
Kenya Student and Novice Nurses has existed for as long as National Nurses Association of Kenya has been in place. Since the National Nurses Association of Kenya has been there since 1963. Yeah. But formally, and to recognize the young nurses formally, we revived it last year in 2019. Where we now went into a formal platform, because we want the youth to have a formal platform where they can be able to be supported to impact on the communities, to give more, to give back to the people that have invested in us, the parents, the grandparents, the teachers. So we needed a formal platform. That's why we came to National Nurses Association of Kenya, and we are very glad to them, by the way, for giving us the platform to which she is a member, and I'm the chairperson. So we're just formalizing things.
And, touching on that, maybe you can just tell us your role in the Kenya Student and Novice Nurses.
Okay, my role as a member basically is my participation. That is very important. And the bonding that we have with other nursing students from other colleges and universities, that is a very vital thing, because KESNOR, or Kenya Student Novice Nurses, is an opportunity for you to just have an outlook of how the outside world is. So the role is basically my participation. That is my foundation, the foundation of my role. My participation in reaching out to the community, reaching out to other colleges or new members in the nursing fraternity. Yes, that's
and maybe
it.
Maybe apart from the social outreaches, what else does the Kenyan Student and Novice Nurses do?
Maybe if I just went back to give a brief of who we are. As a chapter under the National Nurses Association of Kenya, our members are students, all nursing students, both the college and the degree nurses, and young nurses, we call them novice, who are up to 5 years post-graduation, because these are people who are vulnerable, they are people who still don't know their exact way within the profession. So we want to work with them up to the level we feel they are mature enough to now walk their path. So we do mentorship. We do a lot of mentorship programs. And before COVID-19 came in, we had started a eight-month mentorship program where we were we were going to every region, the former provinces, 8 of them, once a month. We go to a region, bring together students from all the schools around the region and a few young nurses, have a mentorship program with them. But as we do the mentorship, we are also doing a blood donation drive. So our agenda as KESNA was blood donation drive before COVID-19 came in. And so we had to really strategize, change fast, and respond to the current needs of the society, which are now COVID-19.
And maybe for KESNA, your organization, does it play roles maybe in placement of nurses or something? Because I know of guys who are done with the nursing, they've gone to internship, but after that they lack employment. Is there a role that you guys can play in terms of placement and helping them get job opportunities?
Thank you so much. I didn't want that to come from me, because the reason we're also here is just to also implore to the government that, see, young nurses are doing something. What if we were given the platform to work even better? By the platform, I mean, I champion a group where we are calling ourselves the unemployed degree nurses. And we're requesting the government, see, I'm here, I'm willing to support you in doing ABCD. I think you heard the CS asking the youth, calling out the youth to come out and support the government. We have unemployed degree nurses, people who have done internship and now they have the license to practice. But we have not been employed. And you can see the other day the ministry called for, the Public Service Commission is calling out for 6,000 employment of healthcare workers. Among the callings, there was no single call for nursing officers or the degree nurses. We call ourselves nursing officers. They only called for certificate nurses and diploma nurses. This tragedy or this pandemic requires combined effort, mixed skills or mixed levels of qualification. What a degree nurse can bring is different from what a diploma nurse can bring. So we need to synergize. We need to bring together these cadres of nursing for us to feel a better impact in society. That's why we've been calling out. I think you saw the other day we were trending on employed degree nurses. We are the champions behind that, and it's part of KESNA mandate to champion for the for welfare of students and young nurses. So the unemployed degree nurses, we believe, are our members because they are up to 5 years post-qualification. We are here, we are championing for them. I'm part of that leadership. I think we've done a letter to the Ministry of Health, and we're still calling out to everyone to listen to us. We're here, we're willing to help the society, but we need a formal platform. We need a platform where we can be able to practice well. and that is only under employment by the government. So asking the government, when you employ next time, when you call out for employments, please consider the various cadres of nursing. And it's not only nursing, even doctors.
Even doctors.
They are going to be
And maybe if I can just throw this to Joyce.
Yes.
Why do you think they prefer maybe the certificate and diploma nurses to degree nurses? Is it because you guys are overqualified?
I don't think there's anything like overqualification. According to me, I think it's cheap labor. You know, our government has this thing about short-chaining people. There's no need of having all these universities opening up. There are so many, and our regulatory body approving of training institutions and having so many degree nurses being trained and they're not being employed. There's nothing like overqualification, because education is an essential factor in nursing care and all other cadres of life. Because when you have someone who is educated, we have capacity building in our areas of work, in our different healthcare institutions. I don't think there's anything like overqualification, because you're adding up to what has been there, and the system is a bit longer than a diploma nurse and a certificate nurse. I'm not saying that they're lower than us, but it's an essential thing to keep our advancement moving and increasing our capacity in our healthcare systems.
So you think there's nothing like overqualification?
No.
And maybe just to
It's
justify,
like building up.
Yeah.
They're building up, yes.
when you look at the training of a degree nurse, it will cost the government an average of about 800,000 annually to train one single nurse.
Yeah.
After that, we go into a year of internship, 12 good months paid, very good pay. I think on average of about 70,000 every month.
90,000.
It's part of the training.
Yeah.
After that, the government doesn't take you up. So why are they investing so much? It's taxpayers' money. It's your money that is being invested in me. Why don't I be given that platform to now impact on you, since you impacted on my life?
Yep. Now, okay, you make a good point. They're investing in nurses, but they're not employing. Where are they expecting you guys to go? Yeah.
A question to the government: where are you expecting us to go?
Now, you are talked about the outreaches you conduct in various parts of the country, but now you find that most major cities are under lockdown.
Yeah.
Do you still have those projects? Do you have people in those other places running those projects? So now, because there's a lockdown, you guys are curtailed.
Thank you. For us, we believe in being strategic and really being fast in what the occurrences of the day. So we understand there's that lockdown, but we have membership across the country. Right now, our members are not confined in Nairobi or in any region, because they are youth. They went back home. So they're in the villages. They're the ones with the grandparents that we have. They're the ones with the parents. So the projects are still ongoing. I know of Kamwangi Market. We've been given Kamwangi Market as KESNA to really reach out to the people and sensitize them and give them hand liquid soap. So what we do, we package the items and send to them. We have focal persons in each and every, not even county, each and every village, because we have so many members as KESNA.
Yeah.
So we just package the items we think we need, the soap, the flyers,
Do you label them and put your pictures on them? Like our politicians and our leaders.
I'm sure even you haven't heard of me before now. So we don't label much. Yeah. We don't want to publicize much, but our aim is to impact to the community.
Not to brand yourself.
I think, let me just come back to me and you. We're all yearning to go back to Mombasa, to the beach. We're all yearning to go and party. Yeah. So we as the youth...
I don't yearn to party. I'm not a party. I'm not a party.
Soon you will be. So we're just working towards returning to normalcy. Yeah. We want to continue creating memes. We want to continue, hanging out. Yeah. So we as youths will do the best we can so that we return to normalcy. And that best we can is you and I. Yeah. Teaching the people in the community, people who don't have access to smartphones, people who rarely go to watch TV. It's you and I to go and tell them, you know what, this is what we can do to end COVID-19 as early as we can so that we can return to normalcy. Yeah.
And maybe just one thing. Today we were celebrating the people who are doing their best to fight corona, and we celebrated Francisca Akinyi, a senior nursing officer at KNH. Yeah. And maybe just to give us a brief, after you've treated those people at Magathi, what are the safety measures that a nurse is supposed to take before, you know, joining her family and members, maybe just members of her family, so that she makes sure that she does not like spread the corona to them?
I think that has been addressed much by my seniors. More so the president of the National Nurses Association of Kenya, Mr. Obengo, has been at the forefront championing for the welfare of the healthcare workers. But briefly, what you can do as a nurse to avoid spreading the virus, because you're from a high-risk place. You've been managing a patient, not a suspect, a patient. So you're at a very high risk of transmitting those infections. So what you can do as a nurse is first understand the donning and doffing procedures of gowns, because it's reported that most of the healthcare workers get infected at doffing or putting off the protective equipment. That's when we get most infected. So let's understand the procedures of donning and doffing. Two, other countries have had to restrict. They put the healthcare workers in one area so that you don't mix with the rest of the public or your family. Where you are hosted by, let's say, a certain apartment is put aside for you, just the healthcare workers managing the frontline healthcare workers. Three, practice normal procedures, preventive measures. Make sure, probably after doing that, make sure you don't use the same clothes used in the wards to go back home. You rather change and leave them there so that they can be disinfected from the facility. Walk home with a different set of clothing. Make sure you practice hand hygiene. Wash your hands all as frequently as you can with soap and water. Sanitize. Keep social distance. While in your own house, you can even prefer to have your own room so that you don't mix with the rest of your family. Let you be brought food, be brought whatever you want, but don't mix with the rest of the family.
Okay, there's a question here from one of our viewers. His name is Flipper. He's asking, who should we take our claims to so that degree nurses, nursing officers, be put in the recruitment list? Does that mean there's something wrong with the board?
Thank you, Philippa. I know he's my friend, a colleague in the unemployed degree nurses.
You have unemployed degree nurses?
We are there. We are so many.
Association.
We are so many. We are so many.
We have a WhatsApp group.
You have a WhatsApp group?
Yes, and a formal leadership where we are championing for that.
I think you should add Klaus in that list.
I will. So I think that the main employer of healthcare workers, of course, right now it has been devolved. So it's the counties that are employing. So our cries can be channeled to either the Council of Governors, so that as they're doing the employment with they have the public service committees in their own counties. Let them involve at least the chief nursing officers in those counties, so that they can be advised on the scheme of service. Nursing has a scheme of service. It's a profession. So it has a scheme of service. It has a ratio of how many certificate nurses to how many diploma nurses to how many degree nurses. Let them consult experts. Don't do it the political way. Don't do it to please one or two people.
Don't do it the tribal way.
The tribal way, exactly. Follow advice from experts. There's a reason WHO has recommended that for every BSN there has to be this number of diploma nurses and certificate nurses. You can't do away with one cadre and still attain the same success.
Maybe now, just as we finish, maybe just one last word from each of you, and maybe anything you have not touched on as pertains to your organization, Joyce.
On the reaching out to the youth, I just like to urge the youth to get their facts right, to just ensure that we don't have anxiety that is going around. Anxiety can really have a turn on your physical self. So it's very important for every youth to have the facts right. They can check on WHO and all other sites that have their facts correct, so that even when they are disseminating the knowledge, they are sure that this knowledge is true and it has gone through the processes that needs, so that it is assured that it is correct. Yes, so it's very important. That's what I'd like to share.
Thank you very much. Rashid?
For me, I'll urge my fellow youths, as we champion to have a formal platform for us to support the government or fight COVID-19, let's also in our own capacity as youths do something. I know it's so good in doing memes. Why can't we be doing memes about prevention of corona? I know it's so good in doing TikTok. Why don't we be doing TikTok on preventing coronavirus? Also, I'll not leave the stage without thanking the people who are supporting, of course, the platform or the agenda.
Yes.
The National Youth Council, I know you've been so supportive, and right now I'm going to get some donations to help us, do our project tomorrow.
Yes.
The National Nurses Association of Kenya for even giving us the platform to work as young nurses. It's a very good thing. Of course, KUTV for amplifying our voice.
Yeah.
I'm sure someone is watching and they want to support us.
Very many people are watching.
Exactly. We're asking you to kindly support us so that we can end this COVID-19 as early as we can.
Oh, okay, your social media platforms and maybe your websites, how people can reach you. Because I know there are a lot of, maybe there are many unemployed nurses who want to reach out to you guys.
Exactly. To the unemployed nurses, kindly join hands so that we can push towards achieving this agenda. You can follow us on Twitter at Kesna. Kesna is KESNNUR. You can write an email to us at kesna@gmail.com, or you can reach to our website through the National Nurses Association of Kenya. We equally have our office at the same place.
Yeah.
That is at the Kenyatta National Hospital, Nurses Complex grounds. Facebook, Twitter, everywhere, Kesna.
Kesna.
Yeah.
And there's this project we run on this show where we at least feed one person or two, because there are very many unfortunate people outside there.
Exactly.
Do you think you guys, maybe you as the chairperson, are you in a position to feed one person because you just need 400 shillings? Or I have ambushed you?
No, not really. It's all about collaboration. And COVID-19 is not only about, it's not only touching your health.
Yeah.
There's more to it. There's the nutrition part of it.
Yeah.
It's said an apple a day keeps
the doctor away.
It's not literally the apple, but it just means it makes you more, your immunity gets better when you feed well, so that you're able to fight this coronavirus. You can see there are so many asymptomatic cases, people who don't show signs. These are people who are nutritionally well.
Those who are eating well, like myself.
So yes, we can support, and it's all about collaboration. I would like to partner with you guys so that as we teach people on hand hygiene, you can come in and feed one person, or we can support you as you go to feed one, we escalate it to even feed 3 or 4.
Okay, now you can just maybe look at your camera and tell one person or two if you're going to feed them today. I'm joking.
But yeah, sure, if you had the project today, I'm willing to feed one.
We feed people every Friday. DJ Dewis is feeding one person.
Yeah.
And then maybe you, another person.
So today we're feeding you together, Kesna and KUTV.
Yes, now this is where people clap, or people are clapping for you. Thank you very much, Rashid and Joyce, for your time. That's a good message you guys are spreading. Keep on doing some good work. They say the youth are not helping in fighting corona, but you guys are the youth.
Yeah. We are.
So keep on keeping on, bro.
Thank you so much.
So tutakuwa tunarudi hapa hivi na mziki mazee kizungu imesha kwa mdomo. Tunakuja kuwapatia mtaratara jo. Kama ulikuwa umetaka kuswitch off tuende kwa TV nyingine juelewe kizungu, nitakuwa nakupatia pia brief kwa Sheng. But for now DJ Dewis anataka kuwaletea mziki. Mazee, thanks mazee for coming through. Si ndio?
Asante.
Chika.
The dope boy from Nairobi, Kenya. Too hot for